Like millions of people around the world, Connor Kroll takes Lipitor, a drug that lowers cholesterol. And like many others, his once dangerously high cholesterol is under control. But Kroll is not the typical patient. He is 16, and he has taken Lipitor for 4 years. His mother says it was a last resort.
I'm not crazy about medications. Nothing else worked. We put Connor on a strict diet at a young age. That didn't work.
Lipitor is in a class of drugs called statins. Statins lower cholesterol levels, and they reduce the size of plaques in the arteries, thereby reducing the risk of heart attack. Obesity is one of the risk factors associated with high cholesterol. 1/3 of children in the U.S. are overweight, and 17% are obese. Childhood obesity is an increasing problem in many countries throughout the world, rich and poor. Now the American Academy of Pediatrics is calling for children to be screened for cholesterol, especially those with risk factors including obesity and a family history of heart disease. The Pediatricians group recommends that children as young as 8 years old with very high cholesterol be put on statins, the same cholesterol-lowering drugs many adults take. Some physicians say poor diet and lack of exercise put children at greater risk for heart disease than ever before. Dr. Sarah Klaus.
The goal is to reduce the bad cholesterol, the LDL cholesterol in children, with the hope of reducing heart attacks and strokes as an adult.
But Dr. Daphne Sue and other physicians express alarm.
Statins or any medical therapy should be used in children only when it's absolutely necessary. Medications of any type have risks, especially in children that are growing and developing.
Some doctors argue that medications are an easier way to deal with the problem instead of increasing exercise and losing weight. Others say there are no studies on the possible side effects of long-term use of statin drugs. But the Academy says doctors have to balance the risks of prescribing these drugs with the risks of not treating children with the warning signs of heart disease. Carol Pearson, VOA News.